I just kept getting weaker. Maybe you had a little pain once in a while, but I didn't know anything was wrong. I just thought, oh, my age is catching me.
The phone fell out of my hand. And I went to pick it up, I couldn't pick it up. And my face is feeling funny. My mouth was kind of twisted a little bit. And I called 911. I said, my right side is gone. The leg, the right arm, and the right hand, I said, they're gone.
About 2 years ago, I had all of the signs and symptoms of breast cancer. And I knew at that point that I was really in trouble.
We decided we'd go shopping, and right before we left, my arms, they just felt different. About 4:30 that afternoon, we decided to go to the emergency room in Shattuck, and they suggested that we be airlifted.
Laura has been a patient of mine for about 3 years now. She had a known history of aortic stenosis, was seeing a previous cardiologist in the past, but somehow kind of got lost to follow up with them and hadn't seen them for a few years.
I didn't know I had anything wrong. I just kept getting weaker. Didn't hurt, not one time. Oh, maybe you had a little pain once in a while, but I didn't know anything was wrong. I just thought, oh, my age is catching me. So it came on, I guess, kind of gradually.
Eventually it led to her seeing Dr. Mullins, who comes here to Shattuck through the St. Anthony's program, and the echocardiogram was done, found that her aortic stenosis was significantly worsened.
And they said I'd been having it for 2 years or better, but I didn't know it. I thought I was doing okay. She said, you've got a leaky valve. When they said my heart, then I got scared, kind of.
But if you have symptoms related to aortic stenosis, then basically you live a year.
And she told me, well, I'll give you 6 weeks at the most.
When somebody comes at an advanced age, if they're well enough and strong enough to undergo the surgery, we offer that to them. And
she told me that I should have it and right away and not put it off. But I put it off a little bit, and I got to thinking, well, bad as I am now, if I get any weaker, I wouldn't be any use to anybody. And I said, I don't want to be a burden to my children, so I'd better have something done.
She was hesitant for a long time just because of her age and other things, but she told me that she just woke up one morning and God told her that she should do it.
When Laura came to the hospital, she really was extremely limited.
I got weaker and I could get a meal and then I'd have to lay down before I could eat, you know, because I'd be so tired.
The first time that I talked to Laura was before she went into surgery. Just tried to explain everything so she would know everything that would be happening when she came out of surgery. Just tried to let her know that everything would be fine and I would see her in recovery.
He was really nice, and he was telling me what they'd do. Of course, that didn't make sense to me. If they had to do it, well, that had to be done. I wasn't a bit scared. Should have been, but I wasn't.
The minimally invasive approach, the small incision approach to surgery, is the same operation whether it's done through a big incision or a little incision. So you get the advantage of survival and relief of symptoms, but it's simply easier on the patient. That becomes a lot more important at the extremes of age. So we see people in their late 70s, early 80s, late 80s, with this valve problem, and certainly we can help them. There's always risk to surgery, but the risk is getting less and less as we become more experienced in operating on people with this problem. And after her surgery, which improved the mechanical function of the heart, she did very well. Now is able to do anything that she wants to do. Well, let me just listen to your heart here.
Okay. We want to keep it going.
That's right. Sounds good.
I think I have.
Have you been up today?
Yep.
Good. So I'm glad you're doing well.
Well, I'm not very good.
Keep up the good work, huh?
I hope so. Yeah. I think I will.
I'm sure you will.
After she came back from surgery, she came to the ICU. Everything was fine. Not having any pain or anything like that?
I'm surprised.
That's good.
Everything's going good, as far as I know.
Well, I'm glad you're doing well, and I'll come check on you here in a little while, okay? All right.
Thank you.
You're welcome.
I felt stronger in just a few days. I really did. And the hospital was wonderful. Rooms were real comfortable, and nurses and everybody. They're real caring and real good.
Laura is super sweet, very sweet woman, very strong. She was really motivated after surgery to get out of bed and get up and move around, and that's what it takes to recover from heart surgery. A lot of motivation.
Her change from how she is now as to where she was before is significantly different. She seems much more energetic, is much happier, seems to be doing much better than when I saw her before her surgery was done.
I feel like a different person already. I really do. I feel like Dr. Lucas saved my life, he and Dr. Mullins.
I arrived at the breast center, checked in. My technician was very compassionate. I felt like I was her only patient that day. She took me right back into the dressing room, and I barely had time to change clothes before she was coming in and taking me for my mammogram.
We do our set of pictures, and we have the patient wait. We don't have the patient dress, just in case we need to do extra pictures or get an ultrasound. And we take it right back to the radiologist, which the office is in our breast center.
Whenever the radiologist read the report, I had all of the signs and symptoms of breast cancer. This came out of the blue. I had absolutely no idea what was going on. My technician came back in, told me that I did need to have another procedure and they could do it while I was still there. My technician that day never left me waiting. She kept me informed as to what was going on the whole time. She didn't allow me a chance to be fearful that day, and she knew that was quite a possibility.
Patients have different places they could choose here in Oklahoma City, and we offer something unique. We offer them the chance to get their results while they're here before they go. So they don't have to wait on a phone call or a letter from their doctor telling them they need to come back in for an extra picture, to come back in for an ultrasound. We're able to give that to them before they leave.
And since I have kept my mammograms up, they had films to compare with. So we went ahead and did that procedure, and they came back and said, "You do not have breast cancer," which I was very relieved to find out. I knew before I left that office that I did not have breast cancer.
A lot of women are planning their funeral when they're coming to get their mammogram, just because they're expecting the worst. With having something in her breast, having a problem, and being able to come in and know before she left that it really wasn't anything to worry about, she appreciated that. We were glad we could tell her.
I think what is really special about St. Anthony is that the employees are all very dedicated to the patient. Because of the type of care that you will get there, they will not ever give up. They will keep looking until they find the problem. They will take care of you, make sure that your needs are met, your family's needs are met. They are a very compassionate organization.
Peace of mind is the best thing I can give a patient, I feel. Besides good results, peace of mind. 9 times out of 10, you can see just relief on their face when you tell them they're normal and to go about business and we'll see them in a year. That's the most rewarding part of my job.
Life is a gift, and I believe that life is to be lived fully each day. Don't wait and say, "I'll do this later, I'll enjoy this later." Do it now.
the last day in July, we decided we'd go shopping, and right before we left, my arms, they just felt different. They just didn't feel like they were my arms. They didn't hurt, they just felt funny. We came home, and the next morning on Sunday, I was still having the same problem. So about 4:30 that afternoon, we decided to go to the emergency room in Shattuck. So we just went over there thinking that they were just gonna tell me what was wrong and send me home.
Charlotte is a patient for whom I provide primary care, so I see her routinely for her checkups and those kinds of things. She's very engaged in her health care. She's someone who asks lots of questions. She is certainly not someone that I expected would have the problems that she had.
When we went to the ER, the doctor who I saw, just as soon as he saw me, he told me what was the matter. I never had any pains or anything, so I didn't even consider it being heart. But he said, I'm going to call St. Anthony's. We have a partnership with them, and since we don't have the people qualified to take care of this situation, then we call St. Anthony's.
When I came here, it was very frustrating because it could take a long time, an hour, 2 hours, even longer, to be able to make the arrangements to send someone to a specialist or a higher level hospital, and that's not counting the time to actually be on the ground to get there or in the air to get there.
They suggested that we be airlifted from AirVac because it takes an hour and 15 minutes where an ambulance is going to be almost 3 or a little over.
As Charlotte was transferred up here from Shattuck to be cared for by the Mark V team, and the first thing we rule out is whether or not it's the heart. And so she did have some changes that made us very concerned about her heart, and so we brought in a cardiologist, and the cardiologist did a procedure to see where the blockages were, found out that those blockages were severe enough that she needed surgical intervention.
I had the procedure where they shoot the dye up and to your heart, and 2 days later I had surgery and had 4 bypasses. And of course I was upset, and my family was upset, and they told me if I'd had a heart attack, it would have killed me. Sorry. And it's been 3 months and it still makes me cry because it scares me.
When I got to know what had happened as far as her being transferred out of here, I was getting information from Saints about what had happened, that she'd had bypass surgery. So I was actually getting clinical reports from her post-operatively from the staff at St. Anthony's, which was great.
We were able to get her cared for, get her recovered really nicely, and because of the support system, because of the physicians acting really quickly, and because of her willingness to be engaged in her own care, we were able to get her back to a good state of health.
I'm on the road to recovery. I'm not quite 100% there, but I am able now to hold my grandkids, my granddaughters, and spend a lot of time with my family and do things that I couldn't do before.
Having the ability to make one phone call with a guarantee of a call back, which is almost always within 5 minutes, from a specialist who I know is going to do everything that they can to be able to take care of that patient, has been a tremendous benefit. It provides seamless care for us to be able to provide to patients, where we know that we can get them to where they need to be without delaying all that time trying to find somebody who is willing to accept their care.
I just can't believe it was me. Even whenever I think about it now or look down there and see this scar, that I can't believe it was me. It just makes you feel humble, and because why am I here? You know, you just never know. And I say thank you every morning when I wake up, because I don't know why I'm here. I guess because I got some grandkids I need to see. But yes, every day I say thank you.
One night when I went home from work, I was talking to one of the workers. The phone fell out of my hand. And I went to pick it up. I couldn't pick it up. I told him, I said, I think I just had a stroke.
He immediately noticed that he was having some problems not only with his face drooping on the right side, but that suddenly his right arm became weak and clumsy, and that he also had some slurring of speech.
And so I called 911, and pretty soon they got there, and they were putting IVs in my hand. But they asked me where did I want to go, and I told them St. Anthony. The doctors there at St. Anthony, the nurses, all so beautiful.
Mr. Buford presents to us a perfect example of a patient who was able to recognize quickly that something was wrong and to activate the appropriate medical services to get prompt evaluation. If he had delayed or ignored his symptoms, his outcome, I believe, would have been much worse than what his final outcome was.
Sometimes I have thought about, hey, will I ever be able to get my hand back, you know? On my leg is coming back. But I do keep the cane around because I have fallen sometimes.
I always say there are two types of patients, those who give up and those who continue to fight. It's those people who have a positive attitude and they're going to participate and they fight, always seem to do better.
At first, I felt like I was going to give up, but I guess it's just that what I'd gone through with my wife when she had that melanoma cancer, that it went to her liver and then it went to her brain. She didn't give up. And she was a small, little, sweet little thing. We were married 45 years, 9 months and 1 day. And I talk to her every day, and I tell her that she's my special angel watching over me. Excuse me.
It's been good to see him recuperate, recover. He's gone from a point where he was significantly impaired to where now he can live a functional life with some mild residual deficits, but still a good quality of life.
Mr. Buford.
Smith, how are you?
Good. How are you doing today?
I'm doing a lot better.
You're looking better each time I see you.
My leg is better.
Okay.
I'm trying to walk without the cane.
Okay.
Yeah.
How's the arm?
The arm, I still can't write with my hand.
Still can't write.
God is good. And I just keep doing the best I can and let him do the rest. When I get up every morning and wake up, and sometimes I may be tired as heck, but one thing I know, I got to talk to God and thank him that I'm able to wake up. And the people at St. Anthony, they encourage you, talk to you. And whatever they talk to you about is always put in God's hands. When you see the cross, you know, hey, they're not there for decoration. It's there for a purpose. And that's the way it should be. That's the way it should be. St. Anthony, to me, is almost like a church, and that they all are service of God. They all was a concern, whether you were their patient or whether you're not their patient. They stop by and talk to you and want to know anything that you need or anything they can do.
Well, I think we have a great team at St. Anthony. They care a lot about the patient individually, and I think that caring comes across in improved results.
Well, they're so caring, I think. All of them, the whole nurses and everybody. They're real caring and real good.
The doctors are really great here. We've got a really good team here. All across the board, we have a lot of good physicians here.
Not only do they have a reputation for how they treat their patients, it's how the employees are treated as well. It's a family atmosphere, really.
It's just a wonderful atmosphere to work in. It's the primary goals of St. Anthony Hospital is to serve the community and to be able to work in a place where we really haven't lost the core values of why we're doing what we're doing is really, really a blessing.
My husband and I talked about the care, and they were also nice. I don't know, I can't say that enough.
The Saints in Action to me just means that we're willing to do whatever it takes to take care of people. It doesn't matter where they're at or where they're coming from. We take everyone here, and we're just willing to do whatever it takes to take care of anyone.
We are pledging our commitment to offer the best care that we can to our patients here at St. Anthony.
Saints in Action. I feel like that's a calling that this is where I'm supposed to be.
And come to St. Anthony for a good faith-based care and a lot of good care across the board, from physicians all the way down to the nurses and techs and everybody.
I've been extremely impressed with St. Anthony's mission to provide good care, and it shows.
The mission pretty much says it all. I mean, you know, it's just we care through God, and that's how we take care of people.
I want to say thank you for being there for me. Thank you for praying for me. I really appreciate all you do.
This was by far the best hospital visit I have ever experienced. Thank you for all your hard work.
The staff there was wonderful. My wait time was short, and the care was outstanding. Thank you for all you do.
I know you care, and all I can say is thanks.
Thanks.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you for praying.
Thank you for your kindness.
Thank you for caring.
Thank you for all you do.
Thank you. You are truly appreciated. Thanks for being there when I needed you.
I'd like to say thank you.
You are so kind and caring.
You are so great.
Thank you for praying.
I appreciate your cheerfulness and willingness to help.
You really listen to me.
And all I can say is thanks.
You are so kind and caring. You are truly a saint in action.